Hey, Ben. Thanks for coming out and speaking with us. The viewers will be very enticed. And we want to first start off with, could you tell us a little bit about the company you're with, Healent?
Yeah, so Healent is a company that's working on a digital health platform for management of orthopedic patients right now, sort of through the hip and knee replacement journey. We have an app that patients can download that kind of guides them through the process, pre-op, post-op, or if they're just looking to manage themselves without surgery, help them treat their arthritis pain. We give them tools for that. We also have a provider-facing dashboard that helps them manage patients through the process, before and after surgery.
Okay. Wow. So when was this company started?
So the company was founded by a guy named Anup Adya, who's in Chicago. Started off really as a more of a dietary app, a way to connect patients through telehealth with dietitians, because his wife was going through some of her own health issues, and really he developed a solution because he didn't find anything out there that was helpful, what he was looking for. I got involved, and so the company's been around for a couple of years in the dietary form. I got involved back in January of this year as they started to kind of pivot, look more towards orthopedics and optimization. So that dietary part of it is still in there and helping patients kind of get healthy for surgery, but it's really grown over the past 7-8 months.
Oh, wow. Okay. It's good to know. And you're a chief innovation officer for this company. Could you tell us a little bit about like what your day-to-day looks like? So that's a pretty big role.
Yeah, so I'm still a full-time practicing orthopedic surgeon myself. So when I first joined the company, it was more of an advisory role. So just kind of, weekly phone calls and a few hours here or there. When COVID hit and there were no surgeries for a period of really a couple months, I had a lot of free time on my hand, which I wasn't used to, but kind of used that free time, became more involved with a company, and that's how it evolved into the chief innovation officer role. So it really became more involved in the day-to-day stuff during COVID. And things have picked back up again, so my role is still there, but not quite as busy. But I think we were able to use that downtime during COVID to kind of get ourselves up to speed and take advantage of really accelerating the development of the product at that point.
Wow. Okay. And just a question I have. So there were less surgeries when COVID hit. Was it because less people were wanting to go in for surgery, or was it because you guys were shutting down a little bit, like a lot of other?
Yeah, it was a shutdown. So basically the thinking was we got to keep the beds open for COVID patients. We can't tie it up with
Right.
elective surgeries. We got to preserve equipment. We don't want to expose patients that are having elective surgery to, potential COVID infections. So yeah, like everybody else, it's sort of the process of we don't really know, what to expect, but we're going to be cautious with this. And, to a degree, patients didn't necessarily want to be in the hospital, but a lot of them, still were frustrated that their surgery got pushed off because I do hip and knee replacements. People are in pain, so they want to get fixed.
Wow. Interesting. Okay. Well, from your perspective, from a chief innovation officer perspective, and how you guys are currently managing the project and growing, what are some of like the bigger challenges that you see from a company's point of view currently?
Yeah, the biggest challenge with anything in healthcare technology is really just kind of the sales cycle and gaining traction and getting people to understand the value of what you're bringing to the table, and also just be open to trying it. I think healthcare is notoriously difficult to sell into, and it's hard to
Oh yeah.
get your message across. So I think that's the biggest challenge, is just kind of opening those doors to the sales cycle and getting your foot in the door, and even once you have your foot in the door, gaining traction and getting movement.
Right. And you guys have to train users to use this, correct? So like, is the adoption of it, do you feel like that's a challenge in itself, or is it pretty, a straightforward application where it doesn't take much training to understand?
Yeah, there's two pieces. So I mean, the patient facing piece is an app, which I think is pretty straightforward for most patients. The sort of the hospital or the provider facing piece of it does take a little bit of training. And so I think that's just getting people on board, and unfortunately, EMRs have given people kind of a sour taste, and everybody kind of gets twitchy when they hear about having to learn a platform, something like that.
Yeah.
EMR and how disruptive it can be. So, that's a challenge to make it as user friendly and to provide that support, and really to make it as least disruptive to workflow as possible.
Interesting. And you're also an orthopedic surgeon. And one of the, from other interviews, we've also heard that the adoption of or the adoption of technology from the physician point of view has been a challenge. So my question to you is, with the current technologies that you use for your practice as a orthopedic surgeon, did you find that originally as a challenge with using these new technologies, like, or maybe it was just using an EMR and EHR, like, yeah.
Yeah, it's always disruptive. I'm probably one of the more tech savvy, tech friendly
That helps.
physicians you'll find. So yeah, it helps. I mean, I'm all about it, and that's kind of how I got involved in the healthcare technologies. I've always had kind of an amateur interest in technology, so it's not an issue for me. But definitely, for other physicians who may not feel as comfortable or feel like the technology actually gets in their way rather than helps them, it can certainly be a challenge. I think that's the challenge for any healthcare technology company is how do you make it the barrier to entry low enough that people just don't, doctors, people in healthcare don't just throw up their hands and say, yeah, this is just too much trouble.
Right.
Because I've already become, 10 times less efficient because of the EMR or this technology. I don't want to add another, thing that's going to make me less efficient.
Oh, yeah. Yeah, that's definitely something I could definitely see. I mean, especially if you got guys that have a certain way of practicing for years and years on over, or a couple of decades, and then you slap a new technology, another technology in their face to, adopt to and use. Why wouldn't it slow things down? So I think that's one of the things in the industry is, how can we train physicians or help them to adopt these new tech devices or systems faster, and have it to where they apply it to their practice.
Right. Yeah, it boils down to the value proposition. Even if you have that low barrier to entry, or it's something that you set it up once and it sort of runs in the background, there's not a whole lot that you have to do with it, which is what we've tried to do as much as possible. Even then, it's, well, why should I use this? Is it going to make me more efficient? Can I see more patients? Is it going to generate revenue for me? Or is it just, an expense? It doesn't necessarily improve my practice. And that's always, I think, another one of the big challenges of proving that value proposition. That's actually going to make your practice better, more efficient, help you generate more revenue or cut down on costs. And those are always challenging things to do in healthcare.
Yeah, definitely agree. And now my other question is, for the technology itself, is there any kind of challenges that you guys see as for the, as it relates to the app, when, users are using the app or whatnot? Is there anything that has been a challenge in that perspective, you feel like?
Yeah, I mean, I think number one, obviously, one of the big things is always privacy and security, and making sure people feel like any information that's in there is secure. And so going through the proper channels with the different HL7 or the other measures, make sure you're complying with all those privacy and security measures, and then making it user friendly. Because again, if patients are using it and they don't get it and they're calling the doctor's office with questions about your app, that's bad. We don't want to be generating more phone calls for the hospital or the physician practice for your app. It's got to run seamlessly. So you got to be able to support it and make sure that you make it as straightforward and user friendly as possible. And and that includes people that might be very tech savvy, and some patients aren't necessarily very tech savvy, and you have to cater to all those people.
Oh yeah, especially if you're trying to get the elderly demographic, or the senior demographic, excuse me. Those guys would probably have a more of a difficult time with learning how to use the app. But I'm sure you guys have some measures to approach that.
Yeah, definitely. I mean, it's just a matter of collecting feedback, fine tuning it, addressing areas that maybe aren't as straightforward or where people kind of get hung up. I think everyone is becoming more and more comfortable with technology, even the more senior patients. So they've
Yeah.
surprised us. I think particularly with telehealth too during COVID. The ability to navigate that. So I think patients are becoming more and more comfortable with technology. Not all of them, but a lot of them are.
Yep. Yep. And it's amazing as far as the telehealth industry. I've done, some more research on that. And since COVID hit, you guys are doing really well. That industry is booming. If I'm not mistaken.
Yeah, I mean we definitely things were disrupted for a while. I think right now we're back um, pretty much to pre-COVID levels of surgeries, maybe not quite pre-COVID levels of office visits and stuff, just because of taking measures to social distance and make sure you don't have too many people in one area at one time. But yeah, I think we've done a good job adjusting and testing people and putting safety measures in place to keep things going.
Awesome. Now, from industry perspective, for the telehealth industry, what do you see as challenges for this industry now and in the future, if any?
Yeah, I think
I'm
it
sure there are
depends on
some.
how you define telehealth. I think a lot of people within medicine and patients think of telehealth as sort of the video office visit. I think that's just a small part of sort of the more broad category of healthcare technology. So I think healthcare technology is going to continue to grow as we're seeing with all the investment. I think the video office visit obviously had a big spike during COVID when people couldn't or didn't feel safe going into in-person visit. And now we've seen as medical offices and hospitals have opened back up that's starting to go back down again. So I think there's a place for that. I don't think it's going to be sustained at the levels it was during the worst of the pandemic, unless the numbers really go back up again and things shut down. So I think there'll be a place for the video office visit, but I think it's going to be not a huge piece of what we do going forward, because there's just something about the in-person visit and being able to do an exam and things like that.
Makes patients feel more comfortable, maybe. I always thought that with the spike in telehealth, it's really going to transform healthcare, because it's showing a lot of people, hey, I don't have to get up and actually go to the in-person doctor visit. I can do it from the seat of my home. But you're saying that now that offices are starting to open back up, there's a little bit of a decline in the industry.
Yeah, it depends. I think it depends on the specialty. I think it depends on the patient. I think it depends on the doctor's office. So yeah, but there's definitely some things that it's convenient. Maybe you don't have to take 2 hours from work to go to the doctor's office and sit there. You step out, find a private place for 20 minutes and get done what you need to get done and go back to work. Or for a more senior person, maybe it's not as easy to get in and out of the house. They don't want to expose themselves, to anything. That there's a role for that. But I think for certain things like orthopedics, where the physical exam is very important to what we do, you're a little bit limited. Some other things, quick check-ins and visits and behavioral health and stuff like that, maybe lends itself more to telehealth.
Okay, interesting. And then as far as the future goes for Healent, where do you think, where do you see the future of Healent going? What does that look like?
Yeah, we think we've created the framework of a platform that right now, is applied to orthopedics and musculoskeletal health, but really can be changed to any specialty within medicine. So it's really a platform for virtual care management that we have the framework, and you just sort of change the content, but you can still have the same sort of basic framework for any specialty other than orthopedics. So we kind of see ourselves as a more comprehensive virtual care platform going forward as we evolve over time, and sort of support that whole hospital in the home concept or self-care concept. And that I think is coming not only because convenience and safety, but also because it's more cost effective.
Interesting. Okay. So there definitely is a lot of opportunity. You guys, it's a virtual care platform that you're keeping flexible. Right now you're focused more on orthopedics, but the concept at some point you're going to be adding additional, I guess, services per se. And that's
Yeah, different areas of medicine, you know, whether it's general surgery or OBGYN or gastroenterology. Again, we feel like we've sort of created the platform, and then you modify the platform to fit those different areas within medicine.
right. I'll definitely be keeping an eye on Healent and seeing what you guys have going on. And the viewers as well. I want everybody to take a look at Healent, Healent.
Mm-hmm.
How you spell it?
You
And
got it.
yeah, and I really appreciate this conversation with you, Ben. It was very informative. And I think the viewers are going to learn a lot from this discussion. But I want to leave with, was there anything else that you would want to share that you have in your mind?
No, I appreciate the opportunity. Anybody that has any questions about Healent or questions about digital health in general, feel free to reach out to me. You know, I'm pretty easy to find on LinkedIn. It's a good way to connect. I'm happy to, you know, connect and share thoughts anytime.
Right. Sounds great. Thank you, Dr. Ben.
Sure. My pleasure.